Hi, I'm HIV.
Hi, HIV.
And for a patient, what happens to them, it depends on the stage of HIV they're in, but overall they become immunocompromised due to the body attacking its own CD4 cells.
I am necrotizing enterocolitis, also known as NEC.
Hi, NEC.
What I do to the body is I have decreased blood perfusion, which causes my intestines to die, and then I have to get them surgically removed.
Hi, I'm ventricular fibrillation.
Hi, ventricular fibrillation.
I cause erratic rapid heartbeats to the body and cause blood flow to be decreased to the body.
Hi, I'm multiple sclerosis.
Hi, multiple sclerosis.
And I am I attack my immune system and the protective sheath that covers nerve fibers.
I'm cholecystitis.
Hi, cholecystitis.
I cause inflammation of the gallbladder due to gallstones blocking the exiting tube of the gallbladder, which causes buildup of bile.
Hi, I'm Addison's disease.
Hi, Addison's disease.
I'm an autoimmune disease that leads to hormone imbalance in the body.
Hi, I'm cervical cancer.
Hi, cervical cancer.
My changes always depend on the stage of cancer that you're in, but it causes the cells to change in a woman's cervix, which can eventually cause the deeper tissues of the cervix to be infected and spread to other parts of the body.
So for the history of our client, as a baby they were born with HIV due to passing of the HIV from the mother to the fetus, and because of this they were started on antiretroviral therapy.
And because of the antiretroviral therapy, the baby actually acquired NEC. Due to this, they had to end up getting a colectomy.
Due to all the stress of the other diseases, our patient developed ventricular fibrillations while driving down the road and crashed their car.
In the hospital, the patient found out that they had a gene for MS and started showing symptoms because of trauma due to the car accident.
The patient then had their gallbladder become inflamed, introducing cholecystitis.
At this point, the HIV had created further complications in the destruction of the adrenal glands, and the patient was diagnosed with Addison's.
Due to the patient's current conditions up to this point, it was very difficult for her to find a job, so she turned to the streets for fast money, which eventually caused her to get cervical cancers from the complications of HIV and the chemotherapy treatment from MS.
For HIV, the antiretroviral therapy is divided into 5 different classes, but one of the classes in particular, the protease inhibitors, cause the drugs for ventricular fibrillation not to work.
Amiodarone is removed from the body. Amiodarone is removed from the body due to the protease inhibitors.
With NEC and MS, you have to take antibiotics after the surgery, and then for hers, you have to take immunosuppressants. They do not interact well together because the immunosuppressants can cause the antibiotic to destroy a microflora, which causes you to get superinfection.
What you said.
With cholecystitis, you'll be put on antibiotics, and for chemotherapy, you have to be careful taking antibiotics. Patients who are on a continuous antibiotic as a treatment, it can decrease a patient's risk of cancer survival.
And as a cervical cancer patient, one of the main treatments is going to be chemotherapy. If a patient develops antibiotic resistance, this becomes very dangerous for people who are on chemotherapy due to the immune suppression. They're unable to fight off infection.
So due to having all of these diseases, one thing that I will not be able to do, or the client will not be able to do, is they're not allowed to drink because the alcohol will influence the metabolism at which the drug is absorbed into the body. And it causes it to release too fast or too slow depending on the patients. And it's mostly because of chemotherapy, which is used with MS and cervical cancer.
So for my patient, or for the patient as well, they will not be able to tan because of the photosensitivity that is caused by the chemotherapy, and the chemotherapy goes along with cervical cancer.
The patient cannot eat foods high in fat because they, due to the cholecystitis, because they have difficulty of breaking down that fat.
The patient should also avoid stress because it can cause irregular heart rhythms. And avoid having unprotected sex to stop the spread of HIV.
The patient should avoid drinking caffeine with Addison's disease because it will cause your adrenal glands to overproduce cortisol hormones, causing higher stress.
The patient is blocked from conception because of a hysterectomy from cervical cancer.
The patient is unable to take laxatives due to potential blockage caused by abnormal intestinal tissues or scar tissues from NEC.
In the end, essentially all of our diseases combined together is going to cause a depressed immune system. It's going to cause cancer. It's going to have dissolved intestines, the chances of our patient actually surviving are extremely low. So this patient is at high risk for death.